Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College and Principal Investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL. I'm also the Program Site Director for HealthWorks, a new COVID-19 program funded by HRSA through a subaward with the Morehouse School of Medicine. Today is Monday, April 25th, 2022. I'm going to start today by providing an overview of the newly funded HealthWorks program, which seeks to increase COVID vaccine and booster uptake through collaboration with small minority and women-owned businesses, large businesses that employ large numbers of African American and Latino employees, and others who are not yet fully vaccinated and boosted, and by training community health workers to reach socially vulnerable populations across Tennessee. Then I will provide an update on how things are going in terms of new COVID-19 variants, followed by an update on new cases, hospitalizations, and deaths, both nationally and within Tennessee. I'm going to present information on COVID-19 vaccines and boosters, followed by an update on where we're at on COVID-19 vaccines for children. HealthWorks is a new program funded by HRSA to increase COVID vaccines and booster uptake in minority and other socially vulnerable communities. It expands the efforts of the Georgia and Tennessee SEAL teams, both by targeting small minority and women-owned businesses and large businesses with high numbers of minority and other socially vulnerable persons, and by training and engaging community health workers in these efforts. In Tennessee, we will be working with small minority and women-owned businesses and business associations across the state to provide vaccines and boosters on site, and will work with the University of Tennessee Health Science Center to train and certify persons as community health workers to engage and support those efforts. To achieve these aims, we will be hiring a program manager, director of training, and data curator in the next couple of weeks. Well, there are a lot of encouraging signs and increasing optimism that we may be over COVID-19. Rest assured, COVID is not yet through with us. The coronavirus seems likely to become endemic, a permanent part of American lives, reflected by a milder illness like the flu that people must learn to live with and manage. But the future also depends on a new wild card, new variants. Most researchers believe other variants are coming because too little of the world is vaccinated. Eventually, some may be both highly contagious and have a knack for short-circuiting the body's immune defenses, lengthening the misery for everyone. Currently, two new strains, BA.1.2 and BA.1.2.1, have emerged in northeastern states and are driving the current increase in cases. It's likely just a matter of time until new variants arise. We know this because the COVID virus continues to mutate and to be transferred to animals and back to people. So what should we be doing? Increasingly, public restrictions to prevent COVID are going away, and more responsibility is being transferred to individuals to protect themselves and their families from COVID. There are a number of measures in each of our hands that we as individuals can do to both protect ourselves and others from COVID-19. Steps include getting fully vaccinated and boosted if you have not already done so, and determining the level of risk you are willing to accept and act accordingly. That may mean wearing a mask, gathering only outdoors or in well-ventilated spaces, being aware of your community risk level, and avoiding high-risk locations and events. In addition, it means routinely testing yourself or family members for COVID if you are having symptoms, like those more commonly associated with a common cold or flu, and include runny nose, cough, respiratory problems, fever, etc. And also being aware of current treatments and where to get them. This may mean talking to your primary care physician to develop a plan in case you become infected. Early diagnosis and treatment remain the best options if you get COVID-19. There is now increasing evidence that while Omicron variants are more transmissible than previous variants of COVID, it is actually less severe. A study of nearly 70,000 COVID patients in California demonstrated that Omicron causes less severe disease than other coronavirus variants. Compared with Delta, Omicron infections were half as likely to send people to the hospital, and the people who came to the hospital with Omicron stayed for a shorter period. The variant cut hospital stays by more than 3 days, a reduction of 70% compared with Delta. Out of more than 52,000 Omicron patients identified from electronic medical records of Kaiser Permanente of Southern California, a large health system, the researchers found that not a single patient went on a ventilator during the study period. Nationally, the average number of new daily cases of COVID-19 over the past 14 days is up 51% to almost 47,000 cases per day. Cases are up in 43 states, flat in 2 and down in only 5. While Omicron variants currently account for 100% in all regions of the country, there are now several lineages of Omicron. They include B1.1.529, BA1, BA2, BA3, BA4, and BA5, and each one has multiple sublineages. The predominant Omicron lineage in the United States is BA2. The national proportion of BA2 is projected to be 74.4%, while the national proportion of BA2.12.1 is projected to be 19%. BA1.1 is projected to be 6.1%, and BA1.1.529 is projected to be 0.5%. Meanwhile, the current 7-day daily average number of hospitalizations due to COVID for the week April 13th to 19th was up slightly to 1,582. This is an 8.2 increase from the prior 7-day national average. Daily deaths due to COVID-19 for the same period fell 9.6% to 376. We can expect the downward trend in COVID deaths to level off or increase in the next couple of weeks as the increase in deaths tend to lag hospitalizations by a couple of weeks. Over the past 14 days in Tennessee, we have seen a reversal in the previous decline of COVID cases. During the past 14 days, the number of new COVID cases increased by 39% from an average of 220 new cases per day to 345 cases per day. Hospitalizations in Tennessee due to COVID-19 have continued to decline by 12% over these past 2 weeks to 225 per day, while deaths declined 91% to an average of 5 per day across the state. The percent of people who are fully vaccinated in Tennessee remains at 54%, where it has held steady for the past several months. In addition, all counties in Tennessee are now in the green zone of COVID-19 community levels, according to the Centers for Disease Control and Prevention. While Tennessee tends to lag other larger states in new cases, hospitalizations, and deaths, we can expect increases will occur in upcoming weeks as the new subvariants continue to spread. Only 21% of persons in Tennessee have received a COVID-19 booster, including 11.5% of African Americans and 5.4% of Latinos. In addition, among those who are most vulnerable to severe effects of COVID, only 10.8% of persons 71 to 80 years of age and 4.6% of persons over 80 years of age have been boosted. In addition, less than 50% of persons on dialysis and 73% of persons in nursing homes in Tennessee have received COVID booster shots. Clearly, much work remains to be done in the area of boosters. The final area I want to touch upon today is vaccines for children under 5 years of age. Vaccines for this population are still in clinical trials by both Pfizer and Moderna. Early results were not encouraging. The FDA earlier this year delayed a decision on authorizing the use of Pfizer vaccine for younger children until data on the effects of 3 doses is available. Meanwhile, in a Moderna phase 2-3 trial dubbed KidCove, 2 doses of 25 microgram vaccine showed a robust neutralizing antibody response in both children 6 months to 2 years old and those between 2 and 6, along with a favorable safety profile. Moderna said its Spikevax vaccine for children elicited anti-coronavirus immune responses that were similar to the high doses in adults. Both Pfizer and Moderna expect to submit their clinical trials results for children under 5 to the FDA in June or July of this year. In conclusion, there is a growing level of COVID fatigue. Unfortunately, we must continue to be on alert as COVID has not gone away and is not likely to go away anytime soon. Towards this end, as we move forward, we must accept greater responsibility for our own risk relative to COVID. And that means getting fully vaccinated and boosted if you are not. Paying attention to your local statistics to be aware when there's an increase in new cases, hospitalizations, and deaths, and level of community risk. If you are over 70, have a compromised immune system, or have several chronic diseases, you need to get both vaccinated and double boosted. For others, whether you get a second COVID booster, i.e. a 4th vaccine, is a decision of risk you are willing to take about COVID and living with the consequences. For now, this is Dr. Paul Juarez from Tennessee SEAL, wishing you a good day. Be safe.